Well, good evening, everybody. My name is Jim Ludis. I am Vice President for Public Research and Initiatives here at Salve Regina University and Executive Director of the university's Pell Center. It's my real pleasure to be with everybody tonight to welcome you to this Facebook Live event. This is an event that we had planned earlier in the semester. We needed to postpone it, but I'm thrilled that we can bring it to you tonight. Before we get started, I want to do a quick plug, though, for the last event of the semester, which will take place on December 8th, again at 7 p.m., also on Facebook Live. And that is a panel conversation titled China Rising, the future of U.S.-China relations, looking ahead to the Biden administration and the very specific challenges posed by China, not just in the Asia Pacific, but also globally. We've got a great panel, a great lineup, and I hope that you will be able to join us for that event as well. That's again December 8th at 7 p.m. here at Facebook Live. Tonight's event, as I mentioned, is one that we've been looking forward to really since the summer. Our guest tonight is going to cover a supremely important set of issues, and I can't think of anybody better to do it. Faith Mitchell, you've got her bio in front of you. Dr. Faith Mitchell, I should say, is an Institute Fellow working with the Center for Nonprofits and Philanthropy at the Urban Institute in Washington, D.C. She's also developing the Urban Institute's American Transformation Project, which is looking at the country's racial and ethnic transformation and what that might mean for the policy community. She's a recognized leader in the world of health policy, philanthropies, and an accomplished author, and we're thrilled to have her with us tonight. Faith is going to make a few opening remarks. I will, of course, be happy to ask a lot of questions. But if you've got a question on Facebook Live, you just want to type that into the comment section. I'll be happy to share them with Faith, and we'll get through as many of those as we possibly can tonight. So without further ado, Faith, again, thank you so much for being with us. Welcome. And why don't you take it away?
Okay, thank you, Jim. Thanks for that introduction. Thanks for this opportunity to meet with members of the university's community. Your invitation was a surprise and really an honor, and I'm really pleased to be with you tonight. I wish I could be with you in person, but that's the story of 2020, right? And I'm looking forward to our conversation and to the audience's comments and questions. So I thought in my introductory remarks, I would just start by giving your audience some background about myself and my interests as a context for some of the things that I'm working on now. So I grew up in the great state of Michigan, and I have a bachelor's degree in anthropology from the University of Michigan. I always knew I wanted to go to graduate school, but it had to be someplace warmer than Ann Arbor. So I moved to the Bay Area in Northern California, where I got my doctorate in anthropology at the University of California, Berkeley. And I ended up staying in the Bay Area for several years, where I worked at the university, UCSF, which is the medical center, and also at two foundations, the San Francisco Foundation, which funds projects in 5 Bay Area counties, and the Hewlett Foundation, which is international, and which was headed at the time by Bill Hewlett of Hewlett-Packard, when he was still alive. And so that's what got me started in philanthropy. And I found that field of working at foundations and grant making to organizations, whether it was in the Bay Area or around the world, tremendously interesting, because it's an opportunity to combine the understandings of social science with the creative power of money. And we might have a chance to go back to that theme in the Q&A section, but I was able to apply what I had learned as an anthropologist with these resources that you could bring to bear. And in foundation work, you get to meet these wonderful, committed people who are trying to make a positive difference in the world. The lessons that I learned during those years about working with communities and about how people's lives are affected by larger forces like policies and power structures have stayed with me throughout my career. And being a grant maker really taught me that we meaning whether it's a city or a state or a country, can't make progress unless everybody is progressing. If some people are doing well, but others are seriously left behind, the collective good will suffer. And I really learned that from just working with all sorts of folks as a grant maker, as I said, in the Bay Area, around the world, Kenyan villages, wealthy, people who were working on projects in San Francisco, kind of the whole social gamut. It was just a very kind of rich and instructive experience. And from it, I came away with this strong value that I feel that inequality doesn't work from a moral standpoint, of course, but also from a practical standpoint in terms of how a society evolves, prospers, and is productive. And that belief is what underlies the American Transformation Project that I'm going to talk about today, and I'll describe a bit in a few minutes. So about 25 years ago, I left the Bay Area and I moved to Washington to serve in the Clinton administration State Department. And I've been in the DC area ever since, and I live in Northern Virginia. After the State Department, I spent several years at the research arm of the National Academy of Sciences, the National Research Council, as it was called at the time, and also the Institute of Medicine. They have both changed their names since then. But that work involved really like bridging the worlds of research and policy and working with policymakers in the federal government and also policymakers who were connected with foundations. So a continuing thread with philanthropy. And then I returned fully to philanthropy at Grantmakers in Health, which I headed, which is a professional association that informs and advises health foundations all across the country. And then I retired from GIH at the end of last year. And since then, I've been a fellow at the Urban Institute. So the project that I'm developing at the Urban Institute is what brings me before you tonight. I'm very interested in the next generation of Americans, what some people are calling Generation Z. So by next generation, I mean the people who are children today, babies, children, and adolescents, just kind of that next cohort of Americans. And what interests me is that about half of Generation Z are kids of color, Black, Latino, Asian, and American Indian. So that's a big difference from when I was a child, when 90% of young people were white. Knowing that so many Generation Z kids and adolescents are of color, right away you start thinking about the challenges that we know, we know that they face in terms of education and staying healthy and getting jobs. I mean, I think we're all really familiar with the statistics. These children are going to be half of the future parents, workers, and military, and what happens to them has national consequences. If we fail at the task of helping them be successful adults, we're really failing our nation's future, just because they're such a huge part of the country to be. So the question is, what can we do now to help them? And that's what my project is really addressing. In particular, what are ways to apply what we already know about how to support young people's healthy development, whether it's in the education area, their health, their workforce skills, keeping them out of the juvenile justice system, the whole gamut. And then, of course, the COVID-19 pandemic simply adds to the challenges these kids face, because as we know, COVID has disproportionately affected Black, Latino, Asian in some areas, and American Indian communities. So that's what's on my mind these days, and I'm sure more details will come out as we talk over the next hour, Jim.
Super, Faith. Thank you so much. So again, folks, if you've got questions or comments that you want to make, go ahead and post them right to Facebook Live, and just click the comment button and type your comment in, and I'll make sure that I share those with Faith, and we'll get you some answers to your questions. But I want to start, Faith. You mentioned there that Gen Z, 50% of Gen Z are persons of color. And I think the data that I saw read that by 2040, people of color will be a numerical majority in the United States. So even before we start talking about COVID, what are some of the specific public policy challenges that we face given that demographic transformation in the United States?
Good question to start with. I think we know that unfortunately, kids of color are more likely to go to schools that are not as strong, public schools, or even you could start earlier than that, less likely to be involved in preschool programs. And then when they go to school, more likely to be in schools that are not as strong. Obesity rates and asthma rates are higher, especially with Black and Latino kids. You have, again, Black and Latino kids in particular, more likely to have some kind of involvement with the juvenile justice system, getting kicked out of school, which is kind of a trigger that gets people, and what people talk about, that school to prison pipeline. So your school experiences can be what gets that started. And then you have the employment challenges, with kids finishing school. And then if you can finish high school, then you can move on to other levels of training, but you have higher school dropout rates. So, there are multiple challenges that these kids face, and, the policy implications kind of follow from that. I think I've always felt the biggest policy implication is probably the political will to make a change. Because one of the things that I've learned just from being at Urban Institute about 9 or 10 months so far this year is that we actually know a lot about how to make a difference in young people's lives. There's just been tons of research, and there's been programs, and there have been evaluations about, how you can encourage kids to stay in school, or the eating part is a little bit harder. Some of the diet, some of the obesity. I mean, we all know that's a struggle. But, with like sort of education, some of the educational challenges and the juvenile justice challenges, or even like the workforce things, all kinds of things have been tried, and people have documented things that are more successful than others. But it's clear we're not seeing those kinds of programs and policies being applied consistently. So I think that is like the overarching policy challenge, is what I was calling like the political will to apply what we know. And now, as this kind of transitional point that you mentioned, 2040 gets closer and closer. And as I said, this is like half the population, adult population to come, that we're talking about. It's like you can't ignore these issues. I was thinking about how when I was a kid, when I mentioned that Black kids were like 10% of the kid population, and Latinos were a very small fraction of the population in those days, and ditto Asians. We know that there was, enormous inequality in education and in these other dimensions, but the numbers were small. I mean, it didn't justify, school segregation or anything like that, but you were talking about a small percentage of the population. Well, that's not the case anymore, And so that's what gives me a real sense of urgency, that we have to, now is the time, almost like now is, because you don't want half of the adult population to be the product of substandard schools. I mean, you just think about the national implications of that. The last thing I'll say on this is something that we see already, is that, for years, demographers have talked about, this change that was coming in the US population, would no longer be majority white and so forth. But they kind of talked about it almost like in a vacuum, I think, minus the kind of political reaction to it, or even the social reaction to it. But I feel like these days we are kind of beginning to live the social reaction. I mean, you hear it in some of the rhetoric. If you go to some websites, or read some material, you will see people talking about this increased diversity of the U.S. population in, very negative terms. And so I think that's another thing we're all going to have to deal with. If you're talking about this is something that's bound to happen, how do we help it happen in a way that is constructive and kind of furthers the greatness of the United States?
I realize that there's probably not an either or answer to this, but when you think about sort of where the greatest resistance to this, to sort of policies that are going to help further that agenda lie, is it a federal policy making issue? Is it an issue for the states? Is it at local levels? Is it all of the above? Where is the friction really for trying to tackle some of these issues?
I think it's all of the above. It's historic, I mean, as we know, and as people have talked about very starkly this year, and with the kind of reawakened social and racial justice movement, it's part of the history of the United States. And we've had opportunities in the past, like during Reconstruction, after the emancipation of the slaves, after the Civil War. It was a time when we could have done things very differently, and things were done differently for a few years, and then it was reversed. So there have been opportunities in the past, and the culture, the culture of inequality took over. So it's long standing, and it's kind of baked into policies. People are writing these books about how inequality is part of, has been part of like housing policy and certainly educational policy, lending policies, kind of you go down the line. And so it's really deeply entrenched and at all levels. And so it does take a kind of different perspective and a commitment, I think, to saying, let us truly be committed to social justice, the way your university is. It takes a different mentality, I think, to at all levels, to make a difference.
So that was so we're talking about the period before the pandemic. Now along comes 2020, and everything gets harder and more difficult. I found you at the Urban Institute because of an essay that you had written about COVID-19's impact, in particular, on children of color. And I wonder if you could just walk the audience through your basic argument there.
Yeah, thanks for that. Um, yeah, so the basic argument was that it starts with what we've been talking about, that we already know that children of color face some uphill battles in several areas of life. And then when you look at who's getting sick from COVID, you can see that it's just kind of multiplying the challenges for them. So, for instance, it said that people of color, especially Black and Latino people, are not only more likely to get COVID-19 and die from it, but they're also disproportionately affected by its economic consequences. And this, the Urban Institute tracks these kinds of things, so that they found that among Black and Latino families, there were high rates of family financial insecurity and hardship during the summer, and also Asians as well, where people talked about, at least in those Black and Asian and Latino families, it was more likely that somebody would have lost a job because of COVID. And it was less likely in white families, although it was still serious, but it was less likely that someone would have lost a job. They also found that there were more Black and Latino families that were going hungry. And sadly, they've been showing these food lines on TV just in the last couple of days. And what's really disturbing is to realize, I wrote this a few months ago, and you think, well, it won't stay bad, but it has stayed bad. So you imagine that these families are not only affected, but that it has been sustained. And so we know that with just those examples of, like, with people losing their jobs and people not having enough food, that those are like triggers of family instability. And then family instability has negative effects on kids in terms of their social emotional development and their academic outcomes. And we also know that when children experience sustained poverty, they're more likely to drop out of high school and to experience poverty as adults.
So, how overall, how would you rate the response of governments, again, federal, state, local, to some of these things? I have my wife is an assistant superintendent of schools here in Massachusetts. One of the great challenges that they had to overcome last spring was the digital divide. A large percentage of students in our I think call us a small city, didn't have Wi-Fi at home. So even if the school district distributed Chromebooks, which they did, wasn't a guarantee that folks were going to be able to get online. How do you think cities, states, towns, and the federal government have done in responding to the specific challenges that COVID-19 has presented when it comes to issues like, educational opportunity and equal access?
Well, I think, you saw the, excuse me, the federal response that consisted of that one kind of wave of pandemic relief that came along months ago. And it has been months ago, and many families have been without assistance, since then. That was the federal response. And my sense is that then what's happened has been at the local level, kind of varying levels of response to situations like what you're describing, where you have kids expected to be, schooling at home, who may or may not have the equipment they need, who may or may not have the Wi-Fi they need. And I get the sense from, just things you pick up online, Twitter, or reading articles in the paper, that many school districts, just on that one point, didn't prepare or couldn't prepare. I remember seeing an image of some kids, they're like sitting outside a McDonald's or something, trying to tap into the Wi-Fi so to keep up with their class. So it wasn't a coordinated response at all. But of course, everything happened very quickly. And I think kind of institutions had to just cobble things together because there wasn't a coordinated kind of federal response, sad to say. And then something controlled at a federal level. There's so much local control that the feds would probably be limited in what they can do. But another example would be just, what you hear about constantly, like testing, availability of tests. We didn't have anything at a federal level, and you just had to kind of, local jurisdictions or CVS or whatever kind of doing what it could do. And I'm certain that lack of kind of a systematic approach is one of the reasons why the country has, in its third wave now. And now, like today, they were saying that the New York City schools are going to have to close, I guess, indefinitely. And you think about all of those kids thrown back into home environments where parents may or may not be there. Parents might have to work. And again, that's especially likely with, say, low-income kids. Often their parents are, working in service industries, or they're, working in hospitals or something. And so the parents can't stay home and homeschool them. They're going to be home by themselves. And you can just imagine what the technical term is learning loss, as a result of that. And so that'll be like a whole other set of policies that would be needed to kind of repair the damage. I was hearing just anecdotally in a meeting a couple of weeks ago at Urban that in one of the African countries, what they're doing is sort of like setting the clock back. They're just saying everybody's going to repeat the grade they were in when the pandemic started, instead of trying to figure out who's learning and who's not learning and so forth. And you just think the Biden administration is going to, have to give us some really good guidance, I think, because we haven't gotten much to date, but some real guidance about how do you kind of heal and repair from all of the damage that this pandemic has done, on top of, as we were saying, on top of conditions that were already less than ideal.
So I want to remind folks that if you've got questions or comments, you can post them right into Facebook Live. We've got a few already, and I'm going to kick off with one from our university president, who asks, what are some of the programs that you have seen at higher education institutions that have been particularly effective in moving the needle on these social justice issues?
That is a good question. I am not super familiar with higher education. I will be very honest. I would say, so this will be a general response, given that I am not a specialist in higher education, that I think I'll refer back to something that I said a few minutes ago. It's like the more students can understand history of this country and how social inequality has been a part of the policy process for so long. I think so the more you know, in a sense, then the more equipped they are to address those policies and to propose new ways that are more equitable going forward. That would be my general response. And as I said, there's a lot of data out there. The information is there, and more people are kind of working on these issues. Awareness is rising. So I think we really have we have opportunities now that we might not have had, like, a couple of decades ago. Yeah.
Well, as a professor of history, I want to fully endorse that recommendation. I'm wondering, from a broader societal perspective, I mean, learning loss, there seems to be that there would be profound long-term consequences if we don't do something to address that. Certainly in individual development, but also probably long-term economic consequences as well. But I'm curious, what can policymakers do? Again, whether we're at the federal, local, or state level, is part of the solution to this set of issues, whether we're talking about the COVID response or even more generally when we're talking about social justice and equity, is part of the solution the way we finance public education in the United States?
I think so. Yeah, and in that essay that you mentioned, again, with the caveat that I am not a specialist in school financing, but there are people at Urban Institute who work on that all the time, and that is definitely one of their recommendations, is that we address racial disparities in school quality, which, I mean, school quality varies hugely, as you know, that we address racial disparities in school quality and educational outcomes by reforming the educational finance system. And also, Urban Institute recommends giving the federal government more responsibility for education, finance, and accountability. It's, again, I'm not a specialist in those areas, but I know that the kind of the local control of school and local financing of schools. Now, I did actually work on a study way back when I was at the National Academy of Sciences that just looked at how property taxes, are applied, for public services, including schools, and the fact that where you have lots of little jurisdictions, like say something like Los Angeles, where, you have, like countless little towns, each one collecting property taxes and financing its own school district. And so as a result, the places that are poorer just don't have the money to put into schools. The places that are richer have lots of money, in contrast with, say, Fairfax County, where I live, where it is actually a county-based system, so that the money gets spread out more equitably across the county. And there are still some differences, in school performance, but the school financing is much more equitable because it isn't based on the, specific property taxes in one little jurisdiction. So I know that changes like that can make a difference.
One of the things that you talked about in the essay and that you've talked about elsewhere in your work as well is the issue of income security. Um, we had that initial wave of relief measures from Congress. That seems like forever ago. If 2020 was a decade, that was in the first third of the decade. What do we need to be doing? I guess initially in this whatever remaining period of the pandemic, and we all pray that it's over quickly. But in whatever period of the pandemic left, what do we need to be doing to provide income security to people? And then more broadly, do we need to rethink the way we provide income security to marginalized communities in the United States today?
Okay, so the first question, the COVID one, I think, yeah, it's pretty clear that families need assistance. Small businesses also need assistance. You see these horrible statistics about the number of small businesses that are going kaput because they don't have they don't have the customers that they need. And so I think that when you talk about, so that's not income security, but sort of economic security, that we need to be bolstering the small business sector as well as families. My sense is that when the dust settles, which hopefully it will one day, as you said, we're going to just see how much people have been suffering, like even more than we know now. People are kind of huddled at home, and I don't feel like we have a really clear grasp of how much the pandemic has affected people of all kinds, and people at every income level. And then with your question about should income security be done differently? Again, not a specialist in that area. I'm a health person, but I'm certain there are better ways. There's so many problems, I think, that can be traced back to how politicized everything has gotten over the last couple of decades, so that issues where we need movement, where you say we need to be putting our best minds together and figuring out what the American population needs, that it's so difficult to get past square one, as you know. And so, as I said, without being a super specialist in kind of income security, I'm certain that there are probably better ways of doing it, but people have got to be able to talk about it without getting scared off by labels, and sort of the pigeonholing of ideas, left, right, up, down, or whatever.
Well, so one of the things that, again, folks, if you've got questions, post them to Facebook Live. We've got three or four in the queue, but I want to throw one more issue onto the table before I turn to those questions. You have extensive experience in the world of philanthropy, and I'm curious your thoughts about the role that philanthropies are playing in the COVID response, and if that gives you any particular insight into either the failings of government or also just more generally the way we as a society are prepared to deal with some of these thorny issues.
Yeah, philanthropy has really stepped up in a good way, both in the context of COVID and also in the context of the social, sort of post George Floyd social justice movement, committing, millions and millions of dollars to in both areas. And I think that's one thing that the foundation community is good at, is responding to a clearly defined emergency. And it was clear that additional resources were needed, and philanthropy has the ability to, muster up money pretty much on short notice, and to dig deep if it has to. And so I think it was good. It's not enough. I mean, the thing is that although philanthropy has those abilities, all the money and all the foundations in the country is still, a drop in the bucket compared to what the federal government has to bring to bear on issues. And so what I'm hoping is that some of the examples that these foundations set over the last few months in terms of where they invested their money, their willingness to invest in new ways, multi-year grants and unrestricted grants. They kind of loosened a lot of their previous guidelines, because they just wanted to get the money out there where it was needed. And in the social justice area, some of the foundations are funding organizations that they never have before, grassroots organizations that are really engaged in racial justice efforts on the ground. I hope that will not be a drop in the bucket. I hope it will be sustained. And I also hope that it will be kind of inspiring to the public sector, because in my old job at Grantmakers in Health, we actually worked a lot with the Obama administration, which was he was president when I went to Grantmakers in Health. We also worked some with the Trump administration. When you with the federal government, they love to say, that they can't do it alone, and that they want private partners. So that I would say, to some extent across administrations, there is that openness to working with the private sector. And I know that with the Biden administration, there will be that openness as well, because they've already invited philanthropic representatives from some of the big foundations to come talk to the transition team. And so you would hope that some of the ways in which as I was saying, that these resources have been brought to bear for COVID and for racial justice will influence some of the spending that the federal government does, or that at least that there will be some partnerships that are good for communities. I mean, time will tell, but I'm optimistic.
You know, I might be putting too many of my cards on the table. One of the things that's always frustrated me is there's a critique that that budgets are ultimately moral documents. And if we as a society value things like diversity and inclusion, but also just equity, and if we really believe in the promise that we are a society that's based on merit, then we ought to be creating systems and spending the money to create those opportunities for all Americans. And I sometimes worry that when we rely on philanthropy to do what is the work of government, that we are letting our public selves off the hook a little bit. Am I being too harsh?
Well, I think I see the critique. Um, I do, having worked a bit in the government and having worked in philanthropy, um, government, as they say, the wheels of government grind slowly, and so that's where the beauty, I think, of the sort of both and solution comes in, that you would hope, ideally, that philanthropy, being more nimble, having that potential to be very creative, will seed ideas, into the public sector and help it evolve. And, sometimes that happens and sometimes it doesn't, but it's hard to get huge bureaucracies like the federal government to change,
Right.
and so, it's got to start somewhere. And I think philanthropy, because it can kind of fund advocacy groups, it can fund data collection, it can bring people together around tables, it can bring government people together with community people and so forth. It has that ability to kind of, nudge the public sector along.
Well, so I'm going to turn to some of the questions here on Facebook. And again, folks, if you have a question or a comment, you can hit the comment button and just type it right into the screen there, and we'll make sure that we get them to Faith. This question is from my great colleague, Laura, who asks, can you address unique public health challenges in both rural and urban settings that are exacerbating COVID-19 risks for marginalized groups?
Mm. Well, okay, in rural communities, one of the factors that is exacerbating COVID-19 risks is the fact that even before COVID-19, hospitals were closing. There was a rural hospital crisis. There was a lack of primary care. I was reading articles about women having to drive, 50 and 75 miles to deliver their babies. And the COVID-19 has just exacerbated that because it's affected the financing of hospitals at the very time when they are most needed. And you've heard some stories just over the last couple of weeks about rural communities in like North Dakota and South Dakota, and how their very limited hospital systems have been just completely overwhelmed by the number of COVID-19 cases. So that's one of the rural circumstances. I think it's also the case that because rural communities are often dispersed, that even at the kind of mitigation level, so not waiting till people are so sick that they're in the hospital, but things like the ability to get tested, and to just find out if you've been exposed and so forth, it's much more difficult in rural communities. So those are a couple factors there. And in urban communities, was the question about health conditions specifically, or just urban conditions?
The specific health challenges in urban settings that
Oh,
exacerbate COVID-19 risks.
right. So some of the health challenges in urban settings are things like, I'm thinking about something you don't necessarily think of as a health challenge, but like people living together. So a lot of times especially in low-income communities, you might have, you know, several people in a household. Maybe you have several families that live in a household. And especially if those people are having to go out to work, they're not working from home. Maybe people are bus drivers or nurses or other kinds of, you know, working in the subway or other kinds of occupations where during the pandemic, they still had to go out to work. Well, then health risk is those folks are coming back home and they can't, you know, socially distance if they're all living together, you know, in the home. And so that's been one of the ways in which COVID has spread in communities, basically because people don't have alternatives. And I know that in some cities, there was a push to house some of those essential workers in hotels that were otherwise empty, just to give them a chance to socially distance from family members to reduce the likelihood of spread. But I know that that didn't happen everywhere, so that would be a health risk. Another health risk that's also not kind of health per se is that I'm thinking about contact tracing, you know, which was proposed as a way of reducing the spread and flattening the curve. But lots of people are suspicious, you know, of government entities, and that something like contact tracing, you know, I know from personal experience from hearing people talk about it, there was a level of paranoia about it, and so that, in its own way, I think, acts as a kind of health risk because it means that people, you know, because of if you don't trust the sort of entities that are asking you to contact trace, then that means that you're not following through with it. And then that's another way in which it's possible for COVID to spread.
Hey, I was looking at the CDC did a report in August about cases, hospitalization, and deaths by race and ethnicity. And if you are African American, the case rate in your population is 2.6 times higher than for white Americans. You're almost 5 times more likely to be hospitalized, and the fatality rate is more than twice as high as white Americans. So these are real meaningful numbers that are manifesting themselves in our communities every day. I've got a question from Julie, another one of my great colleagues at the university. She says, Dr. Mitchell, do you know if health professional schools, such as medicine, nursing, and so forth, will be required to address healthcare disparities in their curriculum? She's a
Mhm.
nursing professor and can attest that, quote, the accrediting agencies have yet to require this in the curriculum. Do you have any insights on that?
Yeah, it's an appalling situation. So I will go back decades to when I mentioned in the introduction that I taught for a while at University of California, San Francisco, which is the medical campus. And I actually introduced a course there that I called Race and Health. And it was for like grad students. But the med school used to invite me to come give one lecture a year to the medical students about racial disparities in health. And, you know, that's hardly an introduction to the topic. And what's distressing is now here we are decades later. And as your colleague said, it's still not a requirement, despite the fact that racial health disparities have been systematically documented since the Heckler Report in 1985. Margaret Heckler was head of Health and Human Services then, and that really kind of brought the whole issue to national attention. And so researchers have been doing the research, documenting the differences like that you were reading about, and yet the health, you know, the schools, and even like hospitals have been very slow off the mark in terms of sort of recognizing the importance of those statistics. I'm actually part of a project right now that is connected with the Institute for Healthcare Improvement. That is one of the elements of the project is trying to get health systems to collect racial data on their patients so they even know what's happening to them. And you would think that that would be the norm, but it isn't. And so if you don't collect the data, you then can't document outcomes, you know, and then develop institutional policies that, align with those outcomes. It's a very sad situation. I think, and I hope that people like your colleague will just keep pushing, because that's what it's going to take: advocacy, and people speaking up and saying we need to know these things.
I know Julie is not shy, and I'm sure she's going to keep pressing. Jasper asks, he says, it's more of a comment, but he says that I like what Dr. Mitchell noted about low income families and how the change to online learning has negatively impacted students. I think another thing to note is that often the family members also need to hold multiple jobs, and with this, the children have even less contact with a parent or guardian. This impacts childhood development as children lack the interaction, and that isolation can be detrimental to growing children. Any
Yep.
comments on that?
I'm just nodding my head. I agree completely. And, one of the things that's been frustrating to me is like watching MSNBC or CNN TV news. And in August, before school started, numerous people coming on saying, we can't open the schools. We can't open the schools. There's a risk. And yes, there is a risk. But thinking about those kids, just as Jasper described, who don't have adults at home who can help them with the material, much less, so they may not have a computer, or they may not have a Wi-Fi, or they may not have enough bandwidth to do what the in-home learning requires. They may not have somebody who can look over their shoulder and kind of keep them focused or help them when they have problems. And I didn't hear the people on television kind of acknowledging that, even if they don't have the solution per se, but at least acknowledge that having kids at home is going to raise some really serious issues, also with disabled kids. People talked about if you have kids with ADHD or different disabilities, that it was almost like impossible for parents to try to teach them at home. So yeah, it's a very difficult situation. I mean, we went into it, you think about how the year started. As you said, Jim, the year started a decade ago.
That's right.
Or even like this time last year, we had no idea what was about to come around the bend, and no preparation. And even though people had been writing books about the next pandemic, I've read a number of them, and predicting it, you sort of still think, oh, it can't happen here.
Yeah.
And like, wow,
I've spent most of my professional life making a living as a professional worrier. I didn't worry enough about this. Garrett, I'm going to try to paraphrase what Garrett's asking here, but are there, how do you respond when you're confronted by people who deny the long-term impact of systemic racism in the United States?
I find it frustrating, and Garrett probably does too, because as I was alluding to before, it's in the historical record. I mean, it's not something when people talk about systemic racism and how long it has sort of characterized American life and the damage that it's done. This is a well-documented story. It's not like people are making it up. It's not just an opinion, or even a belief. It's something that many, many scholars have written about. And so it feels almost, I don't know, you'd say almost willful if someone doesn't want to believe it. The problem is, of course, it goes against the grain of what we've been taught, that we're the greatest country on earth, and and so if you believe that, then it's a difficult adjustment, I guess I would say, to acknowledge the reality of American history. One of the things, if like my parents taught me kind of the real story right from when I was a child. My mother loved history, and so, she would always talk very frankly about kind of, the basis of the country. And she talked about the relationships with American Indians and so forth. So that I'm very grateful that she did that, because it meant that I, just it's like you can love being an American and you can love this country while also accepting the fact that its history is very troubled.
That's a powerful thought. We're running short on time. I've got a couple of other questions here, um, and so we'll do our best. I want to thank Andrea for her comments about some resources that are available online. Megan asks, could you discuss how COVID-19 and the fight for social justice has affected consumers or consumer behavior? And also, second question: has America's struggle with this issues been recognized internationally?
I'll start with the second one, because I know that answer better. Yes, yes, it has been recognized internationally. It's been really interesting. So I studied French as a child, and I try to keep my French sharp. So I listen to French news for, like 20 minutes every night if I can. And I was struck, that from the very beginning with kind of George Floyd and on, the French were talking about it. They were talking about what was going on in the United States. There were people in France, like Africans who live in Paris, who picked up on the issue and said, we have these same problems in France. And likewise, in the United Kingdom, African Americans who live in the United Kingdom said, we have these problems in the United Kingdom. So definitely kind of what's going on in the United States with social justice, the people who are speaking up, LeBron and other voices are heard around the world, and people are watching us to see how we respond and what we do. To the first question, how is COVID and social justice affecting consumer behavior? I remember, I don't know about the COVID part. What I'm remembering on the social justice and consumer behavior was that it was very interesting, like in the spring and summer when there was this sort of awareness of let's support like minority businesses, and let's buy differently. Even here where I live in Northern Virginia on Nextdoor, somebody wrote and said something like, I'd like to patronize a Black business. Where's a Black business near here? So, and I this is really interesting. People are trying,
Yeah.
And that's one of those things where, again, you hope that it isn't just of the moment, and that there is some kind of sustained commitment to doing things differently. And again, I guess I would just say time will tell. Now, on how COVID-19 kind of figures in that, I'm less aware.
Well, Faith, I want to thank you. We know that your work is more than just of the moment; that it is sustained and enduring. And we're thank you for sharing some of your insights with us tonight. We hope that when this is all over, we can get you to come up to Newport. Maybe between May and early October would be lovely, and we can welcome you and thank you in person. Ladies and gentlemen, she is Dr. Faith Mitchell. I know that they're giving us golf applause right now. I will be the surrogate for that as well. But Faith, thank you for being with us, and those of you at home, thank you for joining us tonight. I hope again you'll join us for our next session on Rising China. Until then, be safe, be well. We'll see you soon. Thanks again.